By Texas Senator Ted Cruz that would allow insurers offering Obamacare plans to also offer cheaper bare-bones policies. This amendment may bolster support among some conservative senators, but could upset moderates. Let's talk it over with Senator Ted Cruz's former chief of staff, Chip Roy. He's now with the Texas Public Policy Foundation Center for the 10th Amendment Action. Chip, I want to read you a strongly worded letter by two big insurance trade groups, Blue Cross Blue Shield Association and Americans Health Insurance Plans. And they say this Cruz provision would mean, quote, skyrocketing premiums for people with pre-existing conditions, and millions of more individuals will become uninsured, they say. Chip, this doesn't sound good.
Well, good evening, Anna. Thanks for having me on. Let's first remember the position we find ourselves in, where premiums have doubled over the last 7 years under Obamacare. And in a third of American counties, you can only get one insurer, if you're lucky, sometimes zero. So that's what people are trying to deal with, and that's what Republicans are trying to solve. And they're trying to drive premiums down. And with respect to this Senator Cruz's amendment, what he and Senator Lee were trying to do is provide a safe haven, if you will, a place where Americans can go to get a competitively priced plan. And you would think in the United States that wouldn't be a difficult thing. But unfortunately, the way the bill is crafted and the way that the law under Obamacare is crafted, it puts everybody into a single pool, a single risk pool, which means that premiums most likely will not go down.
But it sounds like this is not the answer either.
Well, if you talk about that insurance company letter, listening to the insurance company guys complain about this is a little bit like listening to the captain of the Titanic complain about how you're putting the lifeboats up. I mean, the head of the person who wrote that letter was the Obamacare administrator. So take that with a grain of salt. What we're dealing with the insurance company.
The Obamacare administrator. I'm not so sure if that's the truth. But if you want to talk about a different group, let's talk about what the Kaiser Foundation has said about the Cruz plan. This is a quote from their vice president, saying, if there were a joy of cooking for insurance, this would be the perfect recipe for destabilizing the market and turning the marketplaces into high-risk pools. So it isn't just the insurance companies that are saying that this Cruz amendment is going to be bad for people with pre-existing conditions in particular and destabilize the market further. I hear what you're saying about the goal of the Cruz amendment, to add more competition and to drive down premiums, and people will say that that could happen for those who are healthier, who are younger, who don't need these comprehensive packages. But everything I've read from the experts in health policy say that people with pre-existing conditions are going to lose. Their premiums are going to skyrocket.
Well, as you and I have talked about before, I am somebody with a pre-existing condition. I care about this passionately. I'm a cancer survivor. We want to make sure that people with pre-existing conditions are covered. But if you don't break down the way that the Obamacare model is structured, and if you don't break it out of a single risk pool, you cannot possibly drive the prices down. And what happened was Senator Cruz's amendment, and what Senator Lee and he were working on, was creating an environment where you could get folks into a high-risk pool, and we could properly fund it and properly structure it, but then break it down so that people could have competitively priced plans. But unfortunately, the Senate leadership left those guys hanging, and they restructured it and put everybody back into a single pool. And frankly, they also threw $182 billion at the insurance companies in what amounts to TARP for the insurance companies. It's another TARP bailout for the insurers. And so the problem is Republicans find themselves kind of in a catch-22. They're not really putting forward a free market solution and that would drive down prices. And unfortunately, Senator Cruz and Senator Lee are the ones kind of holding the bag, trying to fight for the last vestiges of freedom.
I mean, I think a lot of people agree with you that there are problems with Obamacare, and there are a lot of people who want it to work better for them. But there are governors in both Republican and Democrat-led states that are slamming this revised bill. Here's what Virginia Governor, a Democrat, Terry McAuliffe, tells CNN.
We're willing to work with anybody. This is unfortunately has been done in secret. I wish the governors had been at the table. It needs to be done in a bipartisan way, just like the governors work, Democrat, Republican. This has been done in secret. We ought to go to regular order in the Senate. We ought to have hearings, amendments, bills ought to be introduced, and we all ought to work together.
And then there's this from Ohio Governor John Kasich, a Republican. He says this is unacceptable, what these senators have proposed. He calls this, he says the shortcomings flow from the fact that the Senate plan commits the same error as Obamacare. It's not bipartisan. It fails to bring solutions from both sides of the table that can ensure we aren't simply replacing one divisive plan with another. So, Chip, if governors on both sides of the aisle say no, where does that leave us?
Well, I think it leaves Senate Republican leadership with a tough quandary. They've got to look at this and decide how they're going to handle it this next week. And honestly, they really ought to go back and go to what we've talked about before on the show with full repeal. And the reason I say that is repeal it now and repeal it at a date in the future in the certain. And then everybody's going to have to get to the table. And frankly, I agree with what was said, I think, with both governors across the aisle. There ought to be an open and transparent process. There ought to be debate. There ought to be amendments. There ought to be a full debate on the floor of the Senate instead of trying to cook this behind closed doors. I fully agree with that. But at the end of the day, if you don't get to a place where you repeal Obamacare at a date certain, so you can actually sit down with people and decide how to create a health care system that will work for all Americans, people with pre-existing conditions included. Now, keep in mind, that's about 1% to 2% of the population. We don't need to restructure the entire health care system. We are fully capable of coming up with a solution for people with pre-existing conditions without totally restructuring the health care system from A to Z.
There are a lot of people with pre-existing conditions. They matter, too. Chip Roy, thank you for joining us. We really appreciate it. Coming up live in the CNN News.